gosh, Lex, that health assessment test was hard.
Bree, what's wrong with your tongue?
What do you mean?
Look.
Oh my god! Oh my god, someone needs to look at my tongue. It's
Okay,
literally black.
calm down, let me see.
Okay.
Okay, it looks like black hairy tongue, but let me give you an assessment first.
Okay.
Black hairy tongue is a temporary, harmless oral condition that gives your tongue a dark, furry appearance. It results from a buildup of dead skin cells on the papillae or tiny projections on the surface of the tongue that contain taste buds. It may look alarming, but is typically does not cause any health problems and is usually painless and resolves without medical treatment.
Come in.
Hi, Bree, I'm back to assess you now. Lauren will be your nurse. I'm
Okay.
going to start with asking you a few questions. Have you had any recent sores on your lips, tongue, or in your mouth?
No, I had no symptoms, no sores, so my tongue is literally black.
Next, when obtaining your subjective information, ask the patient if they've experienced any sore throats, have history of sore throats, or have issues with a hoarse voice. Bree, do you experience any of these symptoms?
No.
If the patient answers yes to any of these questions, ask the patient to describe them and tell you how often they lasted, if there was any treatment they used, and how effective it was.
For a nursing assessment of the mouth, start by asking the patient questions to get an idea about the amount of mouth care they practice, any issues or complaints that they have, and what you can expect when looking at them.
Okay, Bree, now I'm going to ask you a series of several questions.
Okay.
Have you ever been experiencing any toothaches?
No.
How about any bleeding of your gums?
No.
When was the last time you saw your dentist?
My routine checkup, I think it was last month.
Did you receive any dental work?
Nope, just a cleaning.
Okay. Do you have any trouble when chewing or swallowing?
No.
And any recent alterations how things taste?
Things taste a little metallic-y, but I just noticed it this week.
Okay, that's important for me to know. Okay, and lastly, do you use any tobacco products or have a history of smoking?
I used to smoke, but I quit about a month ago.
Okay. Thank you, Bree.
You're welcome.
Based on the symptoms presented by the patient, my suspicion that she has black hairy tongue is strengthened. This is supported by the patient having a black colored tongue, altered taste, and a previous smoking history. Now I will move on to the physical assessment of the patient's mouth.
When assessing for black hairy tongue, the nurse should pay extra attention to the color of the tongue, the presence of a hairy or furry appearance, bad breath, and if the patient is experiencing an altered taste of food in their mouth.
Now I'm going to move on to my physical assessment. Before you start the mouth assessment, it is important to check the patient's lips. You check the lips to make sure that there is no notable cracks or lesions. Okay, now can you please lift up your tongue for me? Okay, good. The reason I asked the patient to lift her tongue is because I'm noting if the veins are smooth and visible. Next, can you please open your mouth? Okay, good. I'm observing for excess drooling that could hinder her swallowing. And now I'm going to ask you to open your mouth one more time. Okay, good. Okay, Bree, based on your physical assessment, you do have black hairy tongue.
Okay, is it gonna go away?
Yes, you're going to be fine.
Okay.
Although it may look alarming, black hairy tongue doesn't cause any immediate health concerns and will resolve without the need for treatment.
Okay, good.
It is important to brush your teeth and tongue twice a day to aid in the restoration of normal color and texture. Also, keep up with your oral and dental hygiene after this to ensure that this will not happen again. And finally, it is always important to refrain from smoking as well as smokeless tobacco.
Okay.
If your issues proceed, please see the doctor again.
Okay.
Do you have any questions?
No, thank you so much.
Okay, thank you.
Come in.
Hi Morgan, I'm Lauren. I'm going to be your nurse today.
Hi.
I'm just going to do an assessment of your mouth as part of a routine checkup. Can you please open your mouth? Okay, and I'm going to use the tongue depressor just to see if there's any lesions or sores. And can I ask you to lift your tongue, please? Everything looks good.
Thank you.
Just keep up with your regular hygiene. This examined a person with a healthy mouth and tongue. The patient had a tongue with normal color, texture, and had no lesions or sores. Because of this, and because there are no other complications, no further action dealing with the tongue needs to be taken.
Papillae in the tongue grow longer and do not shed like normal. This makes the tongue look hairy. Debris, bacteria, or other organisms can collect on the papillae and result in discoloration of the tongue. What causes black hairy tongue can't always be determined. The potential causes include changes in normal bacteria or yeast content of the mouth following an antibiotic use, poor oral hygiene, dry mouth, medications containing bismuth, for example, Pepto-Bismol, tobacco use, regular use of mouthwashes containing oxidizing agents, irritation due to drinking hot beverages, and finally, eating a soft diet that does not help to rub dead skin cells from your tongue.
Hairy tongue can be diagnosed by eliminating other conditions that may cause a similar skin appearance to the tongue, such as normal variations in skin color, poor oral hygiene, fungal or viral infections, inflammation of the lining of the mouth, and if you are taking medication or eating foods that stain the tongue. With proper oral hygiene, black hairy tongue resolves itself within months.